there, Miss Barkley. How you feeling? Some pain, some abdominal pain, discomfort. Okay. Well, my name's Kylie, and I'll be your nurse, okay? I'm just going to wash my hands real fast. So as I'm washing my hands, I just want to make sure that I do a quick QSIN of her and of her room, take a general appearance of her, notice if she has any IV running, if she's on any oxygen fully or anything. I'm going to take a look at the room, make sure it's clean, there's no trip hazard on the floor. Wash my hands. So what brought you in today? Nausea and vomiting? Diarrhea? Okay, some pain. Okay. So I did get a report from the nurse downstairs. She told me you had a CT downstairs. Good. So your results did come back. Does look like you have a small bowel obstruction. So it's just kind of a blockage, okay? That could be causing your pain in your belly. For that, we are going to have you on a strict NPO diet, so we're not going to allow you to eat or drink anything right now, okay? We just kind of want your bowels to relax, okay? Have a nice break. Okay, so I'm just going to do a quick assessment on you, all right? Can you tell me your name and date of birth? So as she tells me her name and date of birth, I just want to check with her bracelet, make sure she is giving me the right information, which her information is correct. Can you tell me what today is? Good. And can you tell me where you are? Good. And then I'm just going to have you turn your head towards your left and then towards your right. Good. So I'm just going to check for JVDs, no JVDs. Go ahead and feel her skin. Her skin is nice, warm, and dry. No edema is present. I'm going to check her skin turgor. Her skin turgor is good. Check her capillary refills, which are good. Go ahead and feel her pulses. Her pulses are present bilaterally, strong, even. All right, a little rapid. Can you squeeze my fingers? Good. And can you push towards me? Excellent. And pull towards you. Good. Can you wiggle? Good. Any numbing or tingling when you do that? None? All right. I'm going to go ahead and grab your vitals real fast, okay? So I'm going to go ahead and grab her temperature. Her temperature is good, 98.3. All right, I'm going to go ahead and grab her pulse. So I'm going to count her pulse for a minute. After a minute, I got 103. I'm going to count her respirations, but kind of keep a hold of her wrist so she doesn't know that I'm counting, so she doesn't change her respiration rate. For that, after a minute, I got 16. Okay, I'm going to go ahead and grab your blood pressure. So I'll make sure I put it on her arm. Either hit the machine or I can do it manually. So for her blood pressure, I got 118/68. For her oxygen, she's statting at 96% on room air right now. Are you having any pain? Yeah, some abdominal pain. What would you rate that? 1 out of 10, 1 being no pain, 10 being the worst pain you've ever had. About a 6. Okay, can you tell me where it's at exactly? Yeah. Is it a dull, aching, sharp pain? Okay. Is there anything that brings it on or kind of helps at all? Okay. Is it just staying in that one spot, or is it kind of moving all over? Just kind of stay in that one little spot? Okay. I'll ask the doctor to see if we can get something ordered for your pain, okay? All right, I'm going to go ahead and listen to your lungs real fast. Listen to your lungs. Okay. All right, now her lungs are so nice and clear. Go ahead and listen to her apical pulse since I'm right here. I will listen to that for a full minute. Her apical pulse is nice and strong, a little rapid just like her pulse. I'll listen to that for a minute and count that to make sure that her apical pulse and her radial pulses match. Okay, have you having Any coughing or anything? No coughing? Okay. I'm gonna go ahead and listen to your belly real fast, okay? So go ahead and listen to her abdomen. So she does have low active bowel sounds, but they are present all four quadrants. Go ahead and feel your belly, okay? Any tenderness? We're having some tenderness. Where exactly? Over on your right side, some tenderness. Okay. So as I'm feeling, I don't want to push too hard. She does say it's tender, but I do want to make sure I don't feel any lumps or anything, a mass or anything. That's all done. When I have her belly up, I want to make sure I look for any scars or anything. See if she's had any previous surgery, dressings, or anything like that. Any drainage, which her skin looks nice and good. Nothing there. Go ahead and feel her legs, which her legs are also nice, warm, and dry. No edema on her legs are present. Go ahead and feel her pedal pulses. Pedal pulses are present bilaterally. Okay. Check your capillary refills, which are good. Can you push down like a gas pedal? Good. And pull up. Good. Can you wiggle your toes? Good. Any numbing or tingling when you do that? Nope. Okay. So I'm going to let the doctor know that you're having some pain, okay? Do you need anything else while I'm out? Oh, okay. I'll be right back, okay? Make sure she has her call light before I leave, and I'm going to let the doctor know about her pain that she's having. Hey there, Miss Barkley. It's Kylie again. So I did talk to the doctor. He did order you some pain meds, okay? So he ordered you hydromorphone, which Dilaudid, you may have heard. Have you ever had Dilaudid before? You have? Okay. Have you ever had any reaction to it or anything? Nope, you handled it? Okay. He also did order you some Zofran for your nausea. So if you are feeling some nausea, just let me know and I can get that for you too as well, okay? Alright. So I'm going to make sure I have my medications. Before I pull out my medication, I want to make sure that I did my checks. Make sure I had the right patient, the right medication, the right dose. As I come in the room, I'm going to have her state her name and date of birth. Can you tell me your name and date of birth? I would check that with her bracelet and with my computer to make sure I do have the right patient pulled up. I asked her if she's had this before already. She did have a reaction to it. Do you have any allergies? No allergies? Okay. So I'll make sure I have the right medication, the right dose, the right route. Since she has NPO, want to make sure I don't give her anything by mouth. So I do have this to go through her IV. With pain meds, it can de-stress her respiratory rate, so I do want to make sure that I do keep an eye on her respiratory and also her heart rate with this. I'm going to let her know this may cause some lightheadedness or dizziness, okay? So if you have to get up, please call out so you don't fall, okay? All right. So I got my medication, checked that and everything. I'm going to check her IV. Go ahead and check her dressing. Her dressing is nice and dry. No redness, no drainage or anything. Any tenderness when I push around? Oh, no tenderness. Okay. So I'm going to wash my hands real fast. Put on my gloves. Take my alcohol swab. I'm going to clean off the hub of her IV. So make sure I make that's nice and clean. I'm going to grab my normal saline syringe because I want to flush the IV to make sure that it is working before I give her the medication. So I would flush that with at least a minimum of 2 mLs. Flush it with 5 real fast. As I do that, I want to make sure that I keep an eye on her IV, make sure it's not leaking or infiltrating or anything. Any pain when I push that through? No pain? Good. So that's still working. this. So with Dilaudid, usually it already comes in a pre-filled syringe. So I just want to make sure I only give her the 1 milliliter of Dilaudid. So I have that. I'm going to put that in. I want to push this kind of slow. And like I said before, I want to make sure I keep an eye on her respiration rate because it can suppress that. And I also want to keep an eye on her blood pressure and her heart rate. Okay. And then I'm going to flush it again to make sure that she gets all her medication. Push that slowly. All right. And then I'm going to re-clamp her IV. I'm going to make sure that I do come back about 45 minutes to check her pain. I'm going to make sure that I document in the correct format, document the right date and time. I'm going to document the medication that I gave her, how much I gave her, the route that I gave her. I'm going to document the pain level that she had beforehand and how she handled it. All right. Miss Barkley, do you need anything else before I leave? We're good? Okay. I'll be back in a little bit, okay, to check on ya. Make sure she has her call light before I leave. Hey there, Miss Barkley. How you feeling? Good. How's your pain doing? Doing better? Okay. If you had to rate that 1 out of 10 again, what would you rate it? A 3? Good. So that Dilaudid did help. Good. I'm just going to do your vitals real fast again, okay? So make sure I grab her vitals. We grab her temp. You got 98.5 for that. Kind of feel your pulses. So I count her pulse again for a minute. So for her pulse, I got 96. I'm going to count her respiration. So her respirations are 22. So they have increased from the 16 from earlier on the shift. Okay, I'm going to go ahead and grab your blood pressure, okay? So I'm going to go ahead and grab her blood pressure. Her blood pressure is 147/80, which is an increase from the 118/68. And her O2 stat is 93, so that is decreasing a little bit. All right, hon. So I checked your chart and I saw no output. Have you gone to the bathroom since you've been here? No? Well, let's get you up and go to the bathroom, okay? So I'm going to help her sister to the bathroom. So after she goes to the bathroom, I noticed that her urine, she only had 200 out in a 12-hour period. Her urine is very dark and concentrated. So I want to make sure that I do notify the doctor and let him know. All right, hon. All right, so you didn't pee very much and your urine's very dark, okay? I'm just going to let the doctor know, okay? We'll probably give you some fluid for that. Do you need anything before I go? Nope. Okay, so I'll give her her call light, and I'm going to notify the doctor and see what he wants to do about her urine output. Hey, Miss Barkley, it's Kylie again. So I talked to the doctor, and he's going to give you some fluid. So I'm going to bolus some fluid, okay, because it's looking like you're a little dehydrated. And I'm also going to grab some labs, okay, to check your kidneys, okay? So I'm going to make sure I bring my supplies in to grab her labs. So I'm going to go ahead and grab her labs. I want to grab the renal panel. Go ahead and grab that, and I'm going to send those off. And then I'm going to make sure I bolus her the 500 ml. So I want to make sure I grab that. All right. So check, do my 3 checks for her bolus, for her IV. The doctor ordered 500 milliliters bolus of normal saline, 0.9. So I make sure I have that. I'm going to pull up her MAR in her room. I'm going to have her state her name and date of birth. Can you tell me your name and date of birth? Good, that's correct. Correct with the information on my computer also. I'm going to make sure that I spike my normal saline bag. I'm going to prime my tubing. So my tubing is nice and prime. I'm going to hang this up. I'm going to put in the IV. Going to make sure that I put 500 mLs to administer within an hour. So we are going to give her a bolus. So I have that. I'm going to make sure, before I do that, make sure she has no allergies, nothing else is running. I'm going to check the right dose, the right amount, the right access, and all that, which I already did. So as this is hanging up on my IV pole, I'm going to check her IV site again to make sure it's still good. So I'm going to wash my hands. Got my alcohol swab. Going to clean off her hub. And I got my normal saline syringe. That up to her IV. Going to unclamp her IV. And I'm going to flush her IV. As I'm doing that, I want to make sure that I look at her IV, make sure it's not dripping or anything. Her dressing staying dry, no tenderness. I push that, so her IV is still good. And then I'm going to hook up her bolus. Okay, got that hooked up, and then I'm going to hit start on her IV pump, and I'm going to let that run for an hour. All right, Miss Barkley, so I got you hooked up to fluid, okay? So that's going to run for the next hour. So if you have to get up, please call out, okay? So we can help you with the IV pull, okay? And I'll be back. If you need anything, let me know, okay? So I'm going to make sure document in the correct format, date and time. Going to document what I hung up, the 500 mLs. How much I'm going to give her. I'm going to give her the 500, and within an hour, I'm going to document the route of it too through her IV. Okay, so then I'm going to come back in about an hour once that is complete and check up on her again. All right, make sure she has her call light before I leave the room. Okay. Hey there, Miss Barkley. How you feeling? Good. So your IV bag is complete, so I'm just going to disconnect you from your IV, okay? Make sure, turn off my IV pump. I'm going to disconnect her from her IV. I'm going to clamp. I'm going to take my normal saline. I'm going to flush her IV again. Then I'm going to clamp that. I'm going to document the correct format, date and time. I'm going to document that I DC'd her IV. And then, do you need anything else? Oh, all right, I'll be back. Hey there, Miss Barkley. Miss Kylie, how you feeling? Still doing okay? Okay. Have you gone to the restroom since we gave you that fluid? No? Okay. So that was about 6 hours ago. Do you feel like you need to go? You have no urge to go? Okay. So I'm just going to do a bladder scan, which is kind of like an ultrasound of your bladder, just to see how much urine you have in there, okay? So I'm going to go ahead and do the bladder scan. So after I do the bladder scan, I see that she only has 60 mLs of urine made, which is not a lot at all for the 6 hours. We want a minimum of 30 mLs for every hour. So since we did give her some fluid and she's not making urine, I do want to do assessments, especially listen to her lungs, because that fluid had to go somewhere. So I'm just going to do a quick assessment on her again. Can you tell me your name and date of birth? Good. And today's date and where you're at. Good. Can you turn your head towards your left and right? Good. I'm just going to listen to your lungs again, okay? So go ahead and listen to your lungs. Okay. Alright, so listen to your lungs. I noticed that her lungs are now have a crackle to them. Earlier they were nice and clear. Alright. Have you been coughing or anything? No? Okay. Go ahead and listen to your belly. Alright. Brows still sound the same from earlier. And check her skin. Skin's still nice, warm and dry, pink. No edemas present. Go ahead, check her capillary refills. Those are good. Check her pulses. Pulses are present bilaterally. Good. Can you wiggle your fingers? Any numbing or tingling? Nope. Can you squeeze? Excellent. And push towards me and pull towards you. Good. And then we'll feel our legs. Nice, warm and dry. No edemas present. Her pedal pulses are nice and present bilaterally. Her capillary refills are good. Can you push down? Good. And pull up. Good. All right. What was your last bowel movement? It was this morning before you came in, diarrhea? Okay. Just want to make sure. I don't think I got that earlier. So make sure I document that too. So like I said, I did notice that her lungs have a crackle to them. So I do want to make sure that I do let the notify the provider and let him know that her lungs do have a crackle to them now, and that after the bolus she only has 60 mLs of urine in her bladder. And let him know her labs that came back. Her BUN was 56, sodium was 132, creatinine was 3.6, calcium was 7.7, her GFR was 47, phosphorus was 4.8, potassium is 5.5, and her magnesium was 1.4. So I want to make sure he does know all of that stuff. All right. Miss Barkley, do you need anything? Nope, you're good. Okay, I'll be back in a little bit, okay? Thank you. Hey there, Miss Barkley. How you feeling? Good. Well, I'm leaving, okay? So I'm going to be giving Chad report, okay? Okay. So Miss Barkley is a 64-year-old female presenting from the nursing home. She came in due to acute abdominal pain, nausea, and vomiting for the past 2 days. Down at the ED, they did do a CT scan with IV contrast. That showed a possible bowel obstruction. So they did admit her today, this morning. We put her on a strict NPO diet and put her on a bowel rest. Her vitals were normal when she got here. Her pain was a 6 out of 10. I did give her hydromorphone 1 milligram through her IV. She does have that ordered every 3 hours as needed for her pain. She also has ondansetron, Zofran 4 milligrams, ordered as needed, PRN for nausea. She had only voided 200 of urine for me on my shift. Her urine was very dark and concentrated. Let the doctor know. He ordered at one time 500 milliliters of normal saline bolus. So I did give that to her. We also did a renal function panel, was also ordered. Her BUN was 56, sodium was 132, creatinine was 3.6, calcium was 7.7, GFR was 47, phosphorus was 4.8, potassium was 5.5, and her magnesium was 1.4. Like I said, I gave her that 500 mLs. After 6 hours, she still hadn't voided, so I did bladder scan her. She only had 60 mLs of urine in her bladder. I did notify the doctor. Upon reassessment, her lungs did have a crackle. She destatted to 89, which I did administer oxygen, so she is on 2 liters of oxygen now. So we are, after her lab results and stuff, we are treating her now for acute kidney injury. So she'll be here for a while. I haven't done any education or anything on her. Do you have any questions then? Miss Barkley, do you have any questions? All right. Well, I hope you have a good day, okay? I'll be back tomorrow morning. All right.